As one of the newest additions to the over 130 products created by Biogenesis Nutraceuticals, Pro Flora Oral opens doors to a whole new way of supporting health at all ages. This information will be of immediate and particular interest to dental professionals. For the rest of us, the benefits that Pro Flora Oral can bring, far beyond the teeth and gums, will change the way you view health. I'm Dr. Daria Davidson. I've been a practicing physician for over 25 years and have treated over 80,000 patients during those years. Being board certified in both emergency medicine and holistic medicine, I don't know that I've seen it all, but I've certainly seen a lot. Focusing now on integrative medicine, I offer many methods and formulations for the well-being of my patients. Like 10,000 other healthcare professionals who utilize Biogenesis formulations within our practices, I have found that simplifying my patients' choices improves compliance and results. Biogenesis is famous for high-impact, easy-to-use formulations. In just a moment, you'll hear from Dr. Eric Dunbar, a sincere, talented dentist and a friend and colleague for whom I have the greatest respect. In the many conversations we've had over the years, his view of health from a dentist's perspective has really opened my eyes and expanded my vision of the ways oral health impacts overall health. Probiotic therapy has become a mainstay of supporting gastrointestinal and immune system health. Pro Flora Oral is a unique application that brings probiotic therapy into a whole new realm. And stay with us till the end. After Dr. Dunbar takes you through the fundamentals of oral health and Pro Flora Oral, I'll be back to touch on the broader systemic benefits of this incredible product. And you'll hear about a special offer. Here's Dr. Eric Dunbar.
Thanks, Dr. Davidson. I appreciate the kind words. As a dentist, and I've been in practice for 18 years, the concept of prevention has always been of particular interest to me. Since the invention of the toothbrush, dental professionals have been preaching prevention. We've preached better oral hygiene, brushing and flossing, the importance of 6-month checkups. We've tried early childhood education and many other things. Frankly, we've been working to put ourselves out of business. But unfortunately, business is better than ever. Now, why do you suppose that is? Well, it's mostly about a particular bacteria, Strep mutans, the bacteria primarily responsible for tooth decay. There are dozens of different strains of bacteria in the human mouth, most of them benign, but some, like Strep mutans, are damaging. S. mutans leads a short, uncomplicated life. In its natural state, mutans strongly attaches itself to the tooth surface, which makes it difficult to remove. Its primary function is to utilize the carbohydrates you put in your mouth to form a matrix of plaque on your tooth, which it then digests to form acids. While other bacteria in your mouth can form acids, S. mutans blows them away in the sheer volume of destructive acid produced. Understandably, tooth surfaces exposed to these strong acids can demineralize, cavitation develops, and before you know it, there's full-blown decay. Brushing and flossing are the traditional methods of controlling plaque buildup, but bacteria quickly repopulates since it is a practical impossibility to remove every bacteria from one's mouth. Gingivitis and the more severe form of gum disease, periodontitis, begin in a similar fashion. If bacterial plaque is allowed to accumulate at the gum line, the resulting debris of dead and decaying material creates an environment that is well suited for even more damaging bacterial strains. These virulent strains can cause tissue destruction and bone loss around the roots of teeth.
According to the United States Department of Health and Human Services, and I quote, "Dental caries is the most common chronic childhood disease, and its treatment is the most prevalent unmet need." End quote.
Now, if you're not familiar with the word caries, that's what we dentists call cavities or tooth decay. Among children aged 2 to 11, 41% have dental caries in their primary teeth. 42% of children and adolescents aged 6 to 19, and approximately 90% of adults had dental caries in their permanent teeth. Not fillings, caries. 90% of the adult population has at least one active cavity in their mouth? Good grief. In addition to this, a solid 80% of the U.S. adult population has gum disease in one form or another. In spite of our best attempts to wipe out oral diseases like tooth decay, gingivitis, periodontal disease, you can see these conditions are still widespread. Emerging research is pointing to the use of probiotics within the mouth as a safe and reasonable adjunct to improving oral health. Pro Flora Oral is a specialized probiotic formula designed to colonize the oral cavity with good bacteria. Just like in the rest of the digestive tract, if the beneficial bacteria are in high enough numbers, the harmful bacteria can be kept under control. As with other formulations from biogenesis, Pro Flora Oral is a synergistic blend of ingredients. The resulting effect is that the combination is designed to outperform the basic components if consumed individually. There are several different strains of good bacteria in Pro Flora Oral that have been shown to colonize the mouth and make it difficult for the bad bacteria to cause harm. While there are numerous studies on the components of Pro Flora Oral, here are a few of the latest. One study showed a reduction of S. mutans by a full 76% and a reduction of dental caries by 37%. Another study showed complete inhibition of S. mutans growth. Remember how S. mutans firmly attaches to the tooth surface? Well, another recent study showed that one of the probiotics in Pro Flora Oral causes S. mutans to release from the enamel and attach to the probiotic instead. One of the most exciting components of Pro Flora Oral is Bliss K12, a strain of S. salivarius that was first isolated from children who were found to be less prone to dental and upper respiratory issues. Interest in Bliss K12's role in maintaining a healthy environment in the ear canals and nasal passages is evident in medical journals. But in the world of dentistry, S. salivarius is shown to inhibit the formation of plaque by S. mutans. So, in summary, keeping the teeth and gums healthy revolves around keeping the pathogenic bacteria under control. Although probiotic therapy for the mouth has been an area of research for many years, the practical and effective application is finally now available. In one simple, pleasant-tasting, chewable tablet, Pro Flora Oral provides the proper blend of good bacteria for the mouth. It isn't complicated. It's as basic as brushing and flossing. Let me turn things back to Dr. Davidson for a few last comments.
Thanks, Eric. Well, there you have it. Pro Flora Oral brings the concept of helping to maintain healthy teeth and gums to a whole new level, colonizing the mouth with the kind of good bacteria that can help keep the damaging bacteria under control. It makes total sense, doesn't it? But the benefits of Pro Flora Oral reach far beyond the mouth. Research on poor oral health has clearly documented a domino effect, leading to inflammatory responses throughout the body with all the resulting damage. In addition, many studies have shown that certain pathologic bacteria, the most notorious being Strep pyogenes or Group A strep, commonly associated with throat, sinus, and ear issues, have difficulty taking hold in an oral and nasal environment with the probiotic strains found in Pro Flora Oral. Probiotics are not a treatment for any disease. As a nutritional supplement, Pro Flora Oral is designed to support the healthy environment of the mouth and nasal passages. It provides a simple and smart addition to our healthy lifestyle choices throughout all stages of life. Should Pro Flora Oral be a part of every healthcare and dental practice? Well, based on all of the evidence, absolutely. Thanks for listening.